Hello everyone, myself is Ranjan Kumar. I am physiotherapy student. So in the series of biofeedback, we have taken another subtopic in there. So what is that? So in biofeedback, in indication of biofeedback, what is that? So where we can use in biofeedback, like in neuro, stroke patient, cardio patient, OBG patients, very different kind of patient who have suffering different kind of disorders, and they can help to improve and balance coordination, neuromuscular facilitation and different kind of activities. So where we can use in biofeedback, muscle re-education. What is that? So after any kind of injury, post-traumatic fracture, or any kind of surgery like ligament or tendon surgery, so we can helpful biofeedback to show what kind of activity patient performed, and machine or biofeedback what they can activity show. So it is different, but follow up by the patient, they can definitely improve their coordination, balance, posture, and muscle re-educate after any kind of surgery. Second one is neuromuscular retraining. If there is any kind of spinal cord injury, road traffic accident, hemiparalysis, quadriplegia, so any kind of stroke injury, so they can help to rehab them. Or also if they're kind of facial palsy, Bell's palsy, also they can helpful on to them to rehab the patient. Muscle relaxation. So if any kind of tension, anxiety, headache, spasticity, torticollis, so they can show what exactly happened in the patient and which activity they can perform to enhance their muscle balance, power, or endurance. Also their proper posture and reduce their headache and spasticity. Posture correction. The machine is also aware about that. Posture correction. If any kind of patient who have been not available good posture, like slouched posture, scoliosis, hyperlordosis, hyperkyphosis, so they can tell how the activity perform and which exercise they can perform to enhance their muscle and reduce their spasticity to perform adequate or to regain adequate posture. Pelvic floor muscle training. So there is any kind of spinal cord injury patient, and they have also suffering from quadriplegia. There is no any kind of signal came in our brain for the pelvic floor muscle, so there is gone for the paralysis. So a biofeedback machine is so that your pelvic muscle is not you're under control. So you can there can some machines and devices, so they can enhance their capability to control their bladder movement or ball movement. Also their neurologically incontinence, urge incontinence for their patient, immediate helpful, and they can show their uh, on the machine screen what activity they can do, which gadget they can implement on that on the pelvic floor muscle for the retraining, for the apply the galvanic current, for the low frequency current. That is helpful for the muscle re-education and also the pelvic floor muscle retraining. Chronic pain control. If patient suffering from chronic pain, long duration radiating pain like sciatica or hamstring pain, so there is helpful on them which exercises, which stretching technique they can helpful to them by on activity or passively applied by the therapist, or also they can contraction relaxation of the muscle, or different kind of activity to relax their chronic pain on control over there. So in medicine psychology, so what is exactly happening in psychology? So in medicine, medicine that cause hypertension, migraine tension and headaches, anxiety and stress management, Raynaud's disease, attention deficit disorder. So this is the medicine psychological disorder. So if any patient who are suffering for this kind of disorder, biofeedback is also helpful for them for treatment or rehab protocol perform on that the screen where we have to patient who have been suffering for any kind of this disease. So biofeedback equipment and their what biofeedback equipment and also what their role in our body, like rehabilitation. So there is equipment and functional role. So EMG electrode, electromyography electrode, there is surface on electrode. So detect electrical muscle activity. If their muscle is not activated, like the innervated, re-innervated, like partially innervated, so they can show about that and tell about us what activity we can do for in paralysis paralysis or denervated kind of nerve to re-innervated to come to re-innervated, or also which gadget and equipment, or take example if there is nerve is denervated, so applying for the galvanic current for muscle re-education, so on that place. So there is a surface electrode or needle electrode. So the surface electrode for superficial skeletal muscle, and needle electrode for specifying of deep muscle or any kind of muscle for checking that is it is denervated or innervated. Second one is amplifier, increase the small signals to neurosable level. So what is that amplifier? What is the work of amplifier? So it is go down into the skeletal muscle, or check the muscle contractility or or action if the nerve is activated over there or not. So there is also filter, remove unwanted noise or interference. So there is a electrode inserted into the body, so they can compensatory movement occur inside the body, so they can reduce them, and also in the reduction. So there is a helpful for those patients who have nearby the surrounding there is some noise, compensatory movement of the different skeletal muscle, or heartbeat movement, or ball and bladder movement. So there is also respiratory movement occur on that place, so they can filter it out. Display unit, so output needle bar or light or sound. So there is some sound output in biofeedback machine, so they can help needle bar or light sound produce over there. So we can easily identify, therapist easily identified what kind of muscle is contracted, which muscle is contracted, it is educated contraction happening on that place is okay or not. So that is display unit showing by the sound, by the needle or bar showing on the screen. processor or control unit convert signal into the usable biofeedback form. So there is like a processor inside the machine. They can like helpful for the patient to like there is uncontrolled movement, or like there is a firing rate is too much high, there is like too much signals came around towards. So they can biofeedback there is useful for that patient for like signal enhancement, or like there is no any kind of signals came in our skeletal muscle towards the body. So biofeedback machine, so that there is a muscle is denervated, also nerve is denervated. So we machine will be provided us which activity, which exercises a patient will be performed to regain, or rehabilitation will be techniques apply on the patient. So it will be strength occur, endurance occur on the patient, and nerve denervated to goes to re-nervated. Computerized biofeedback system, what is that? So it is provide real-time digital graphs and store data for progress tracking. So there is a machine who have been shown the real-time data, like if patient are doing any kind of activity, and we can apply the machine on that particular muscle for checking it is active or not. So they can show us the real-time data as a graph, or like as a sound, beep sound we can show on the real biofeedback machine. So that is computerized biofeedback machine. So electrical noise management in biofeedback. So there is a noise around in biofeedback machine. So how they can helpful? So electrical noise, unwanted electrical signal that interfere with the true biological signal, causing inaccurate reading or biofeedback. If patient have like any kind of difficulties, so we are checking on that, applying the surface on the electrode, and in the output, like in computerized processor or display unit. So we have seen some compensatory movement, or there's some other noise will be come. So as a therapist, they are not like take too much attention over there. Either they can think about that for those muscle who have been not activated. So do not mix up this thing in biofeedback machine. There is a problem to make a graph exactly which muscle is activated or not. If you are like if you am like, take example, I'm checking the hamstring muscle is activated or not. So we can apply the instrument or biofeedback on that particular muscle for checking it is like activated or not. It will be not. We can checking for the if muscle is not working. So there is a compensatory movement during the environment, or there is some other noise, and also there is a other kind of skeletal muscle who have been like activated, or there is noise is come around us. So like making a graph is too difficult. So we have some precaution doing that during the biofeedback machine implementation on the patient. So source of noise, what where we have like a source that come. So poor electrode contact with the skin, like we have not placing any kind of electrode on the surface, exact surface of the skin. So there is a air or air is passing to the skin. So there is a some noise come to the air. Movement artificate. So if patient is moving any kind of activity, so there is another noise will come on that place. Electrical interference from nearby. So there is any kind of electrical interference, like we have like applying two electrodes nearby the surfaces. So there is a compensatory movement like crossing each other. So there is another noise will come around us. Second is mechanics, like diathermy units of lights. So there is another source of noise. So next is power supply fluctuation. So if we are using in biofeedback in pulses mode, so there is a power supply is cut it down like alternating current or like direct current. So there is a fluctuation of the current. So we are not adequate or proper sound will be came on like whether you have checking like single muscle or like group of muscles. So there is a compensated sound will be occur on that place. Cable movement or improper grounding. So we have not like placement of the electrode, either like in surface electrode or like mirror electrode. So there is a if there is no any kind of proper grounding, so there is some noise, like patient is properly is like touches the floor of the ground, their leg, both of the legs. So there is a coming the proper sound. If the patient is not touches the ground, there is a laying on the plinth. So sometimes there will be noise come around the nearby the environment. So noise management and minimization, what activity we can do for noise will be reduced or like managed. So proper skin preparation, so like clean the skin, remove oil, dead cell before the electrode placement. Like we are sanitize over there, like checking the muscle activity over there. So we can clean them, sanitize them, remove oil, dead cell, debris for before the electrode placement. Use silted cable. The cable is like we are using different patients, so cable will be like still will be removed. So there is a like compensatory move over there. So now not a correct sound will be coming over that place. So preventing of that thing. So electromagnetic interference will be occur. There is a grounding. Ensure device and patient are properly earthed. The device, also the patient, we are touches the surface of the ground. So that is the noise management or minimizing. Fifth one is fourth one is stable environment. Avoid using near high frequency machines. So in our like hospitals or like clinic, there is a other machine also working over there. So there is a noise will be also occur during the treatment time. So for avoiding this thing, to isolate the machine and in a different room and check the patient, like it is either denervated muscle. Secure electrode prevents movement and loose contact. Don't loosely bounded like needle electrode or cable electrode or like surface electrode on the patient. If there is like loose is bounded, there is like noise came around on the machine. Or like calibration, regularly calibrate equipment to maintain accuracy. So for regular basis we are checking on the machine is working or not. So it will be helpful in machine for the new patient will be came, and the for the machine will be working or not, so we can calibrate those things. So that is the biofeedback ending here. It is a part 2. Thank you.